Sarah, so we're talking about suicide, a really difficult subject for a lot of people to talk about. Why is that so hard?
I think suicide has a lot of complicating factors. I mean, I think it's hard for young people to talk about, as well as hard for people our age and people who are parents to talk about because of the complicating factors of mental health, of not admitting to sort of having issues, sort of some of the stigma attached to it, as well as not knowing what the resources are.
And in reality, a lot of science says it's a subject we should be talking about.
Oh, absolutely. I think there's a lot of fear that if you talk about a sensitive subject like suicide, that it will motivate somebody to then contemplate suicide. But that's not true. We know from research that's not true. That if we talk about suicide, if we talk about some of the things that lead up to suicide, we have a much better chance of addressing things early so that it doesn't lead to a completion of suicide.
Why is that?
Why is it that that if we talk about it, it can be beneficial? That's a good question. So I think it normalizes the conversation. I mean, certainly we don't want to normalize the idea of suicide, but we want to normalize the conversation about mental health. And suicide and mental health are very interconnected. We know that often there are issues of isolation, possibly depression, when a suicide happens. So I think being able to talk about it early on, normalize the conversation of mental health, and not just wait until there's a problem or wait until there's a crisis before we address these things, can really be helpful. And honestly, something as simple as talking about it can make a world of a difference.
You know, we say early on often. What does that mean? Exactly about what age should you be talking to your kids?
Yeah, I love that question because I would say from birth. There are things that we can do to support our kids' social emotional development. It's not just a conversation about preventing suicide or a conversation about suicide. It's having conversations from early childhood on about healthy social relationships, healthy emotions. And if we can start those conversations early on, even obviously with a 2-month-old, it won't be as much of a verbal conversation, but showing interactions, modeling sort of social interactions and relationships and sort of that serve and return. And then when kids get into school, there are ways that we can have sort of different kinds of conversations that are a little more complicated. And there we can start talking about mental health, but certainly want to continue to support kids' social emotional development as well. So as early as when kids are newborns and the way that we interact with them can start supporting their social emotional development.
It's really instilling that sense of transparency in them.
Absolutely. I mean, that to be able to let our kids know if we're uncomfortable having these kinds of conversations, then our kids are going to be uncomfortable having these conversations. We're models to our youth, whether it's somebody who has children or doesn't have their own children. We're all models to the youth in our communities, and we need to think about how our modeling is going to impact youth and how they respond to things and how resilient they are.
So for parents who are uncomfortable talking about suicide, where do you suggest they start when talking to their kids?
I think there are 3 things that parents can really sort of be thinking about doing, and there's no one solution to it. Any one of these things alone probably won't be as effective as sort of trying to combine all 3. And the first is, as I mentioned, supporting their social and emotional development. That we really need to encourage our kids to have relationships with to have friendships, have relationships with trusted people, have a trusted adult to go to, supporting their social emotional health. The second part is knowing warning signs. Parents need to understand that when their kid seems a little off. And at those points, they can say, hey, I noticed that you used to really like going out after school with your friend next door and you haven't been doing that. What's going on? And I think the third thing is asking some very direct questions. If there's a concern, if a parent really has a concern, they've seen something concerning, to be able to talk about that with their child or their youth in a way that isn't confrontational, but instead is supportive.
You mentioned this a little bit, and something that parents ask a lot are what signs should we be looking for? But it's not always as simple as looking for a sign.
Right. Yeah, I mean, I would imagine that many young people who are considering suicide might put on a pretty good front. So I think it's less. I think it's a combination of not just looking for signs, but also encouraging sort of social emotional growth and development and sort of expression of emotions, and as well as looking for signs. But also, being able to look at things other than kind of outward appearances. So don't just look for, is my son or daughter smiling today? But also look for, what are they doing? What are their activities that they're doing? Are they eating the same way that they have been eating before? Some of those things that might be not as evident when you're sort of looking for an expression on someone's face, that might tell you, that might not tell you as much about what's going on inside.
Sure. And for people that are watching this, when do you suggest they start having these conversations?
Early elementary school, I think school age is a really important time to be having these kinds of conversations. We know that kids as young as 8 and 9 years old are dying by suicide. So we really need to not wait until high school. Certainly high school and middle school are great places to have these kinds of conversations, but we need to start earlier. We need to start in elementary school. The language can be different. We need to make sure we use sort of developmentally appropriate and age-appropriate language. So instead of talking about depression or anxiety, we may want to be talking about, not label it quite as such, and instead talk about how your day was. Were your friends, did you have a chance to get together with your friends today? And sort of ask questions about their interactions with other people and their own emotions, rather than asking direct questions like, are you feeling depressed? Which might be more difficult for a younger child, because they might not know what that means.
Sure. So for a parent who's watching this, is it as simple as going up to your kid and just asking how they're feeling or how their day was?
So it's funny, I asked my 11-year-olds this before I left today, and they said, if you probe with a whole lot of questions, it can become really hard for kids. So I think what I heard from them and from both my parental and work experience, I think it's asking questions that may not be sort of such direct, pointed questions about depression or anxiety or suicide, but conversations that are kind of engaging. Because if you ask a question like, are you feeling? You might get just a no answer. And that kind of ends the conversation. So asking questions about, hey, so what kinds of things happened today? I know you had that art project that you were going to be working on today. Tell me a little bit about how that went. Did you have any friends helping you out with it? And I think we can get more information that way than by asking a yes or no question.
Oftentimes, a lot of the resources for these kids and their mental health is at school. What happens during the summer break when they don't have access to that?
Yeah, I think we really need to pay attention to what community resources there are and what communities can do, as well as what schools can do. And unfortunately, I think schools often sort of get the brunt of the responsibility, or feel like they have the brunt of the responsibility. And to acknowledge and support communities as a whole in suicide prevention, in supporting mental health, is just as important, particularly in times like now, these 3 months out of the year, when kids aren't seeing their friends as often as they might have been, so they don't have perhaps as many peer connections. So a few resources. I think parents can get some great resources online. In Colorado, we have a Let's Talk Colorado initiative. It's letstalkco.org, where parents can get information about how to start some of those conversations. We also have a very good crisis and Safe to Tell and our crisis line that parents, I think often parents don't realize they can use our crisis services in Colorado, and not just for crisis services.
I wanted to ask you about that. I think a lot of people shy away from it because it has the word crisis in it, and they feel if they're not having what they define as a crisis,
right,
then they won't use it. But really, it's more of a resource tool, right?
It sure is. We need to come up with a really sort of a good nomenclature for it. So it's as well as being for an individual who might be feeling like they're in crisis, it's also for an individual who might not know kind of what to do with their feelings. Like, I don't know what to do. I had this sort of difficult time with my friends today. And there's a text line, which I think is much more appealing to youth. And so the text line, and I'm sure folks know about it, but I want to say it anyway. It's if people text TALK to 83255, they can access a text line and have an immediate response. But I think what also parents don't know is they can use it too. So a parent who is looking for resources, because I think my child might be having some issues and I'm not quite sure where the first place is to start around mental health, they can contact the crisis services as well to find resources. And I think that's not as well known.
Are these conversations that we're talking about, are they something that everyone should be doing whether you suspect something in your child or not?
You bet. I mean, that gets back to normalizing the conversation. If we only talk about issues when there's an issue, it's going to be much more difficult. And we ourselves, as I as a parent, am going to be much more sort of in crisis myself. And I want to be able to have those conversations when things are calm, when things are. When I'm feeling like, I can sit on the couch and just kind of start a casual conversation with my kids.
I want to go back to a point that we had brought up earlier, which is that a lot of parents have said they're afraid to talk to their kids about suicide because they're afraid they're planting those thoughts in their own kids.
Yeah.
Is there any truth to that?
No. I think talking about, certainly parents should be wary of constantly talking about suicide. I mean, there are other things to talk about that can help prevent suicide and that can help sort of parents better understand how their kids are feeling without constantly talking about suicide. We need to talk about mental wellness. We need to talk about friendships. We need to talk about hope, isolation. If our kids are feeling isolated, parents can talk to their kids about that. Hey, would you want to join an activity? To try and get them better connected to their communities. The conversation to prevent suicide doesn't always have to be about suicide.
It's a really interesting thought right there. I never even thought about that. So what would you say for parents who can't afford therapy for their kids, who can't afford therapy for themselves? What are things they can be doing at home to really help their mental health?
So even if a family might not be able to afford therapy, which they should, and it should be, we have mental health parity, and we should be able to cover mental health needs in the same way that physical health care needs are being met. So if a kid is going in for a well child visit, there should be mental health coverage as well. However, I hear your question that some people don't have that. And there are things that can happen at sort of at home or in just sort of day-to-day practice. And I think that's those are some of the things around sort of talking about emotions and encouraging our kids to have social interactions, not being afraid to and even sort of have playful conversations. I think we like to be so serious as parents, and it's really hard for us to sort of lighten things up. And so I think it's really important for us to remember that the more we can have just good conversations with our kids, the more likely it is that we can have good conversations about mental health with our kids. So it's not all about mental health. It's about building relationships with our kids in ways that then kind of normalize and make it more comfortable for all of us to then talk about mental health and suicide prevention.
So is this a conversation you can just have one time or even just a few times with your kids?
It's a long term. We really need to recognize that kind of like when somebody does a training, you can't just do a training and then be an expert. Just like having a conversation with, a parent having a conversation with their child isn't going to provide all of the solutions or kind of answer all the questions. It really has to be kind of a marathon rather than a sprint.
And we're learning more as we go.
Absolutely. Yeah, I mean, not only through research, but through just sort of what we see happening in communities. I know that schools are becoming much more responsive to the needs of their students in terms of their mental health and social emotional development. We have some states now, and we here in Colorado are hoping to work on this coming legislative session, that we have states who are implementing mental health curriculum in their schools, who are providing their students with mental health days, which I think is a wonderful idea. And imagine a poor student who wants to just take a mental health day and can't because they have to lie and say they're sick when they just need to take care of themselves.
And when you take care of yourself, essentially you are sick. You're almost not lying there.
Yeah.
But I get what you're saying. Yeah, absolutely.
Yeah, I mean, I think we need to sort of move to a mental wellness. We need to take care of our mental wellness rather than waiting until we're really feeling low and down and can't get out of bed.
That's all the questions I have. Grady, is there anything that I missed that you?
Not that I have, no.
I think that we got everything covered.
Okay.
Is there anything I didn't ask you?
I mean, I think just some of the other resources.
Yeah, if you want to list some of those for us.
Yeah, I mean, we've got on our website at mentalhealthcolorado.org, we have a need help section,
okay.
And I would really encourage people to go to our need help section, and we have a section there specifically on concerns about suicide. So we have a number of resources, both here in Colorado and some national resources, I think that can really be helpful in parents helping to craft their message or how to be more comfortable talking about mental health.
Perfect. I will be using that in our web article. Sarah, I think we're good.
Great.
Yeah,
all right.
Thank you so much. I
You
appreciate
bet.
you coming down and doing all that.
Oh, sure.